Good afternoon. Thank you all for joining us, whether you're here in the auditorium with us or joining us online. I'm Natasha Jones, Director of Customer Service in the Executive Office. I'm excited to be hosting today's Employee Town Hall here for King County in the Mailing Regional Justice Center. We are in Kent this afternoon. We're taking this show on the road for the very first time so that we can meet employees who don't work in downtown Seattle, where we've been having these in the past. I'm also excited that this is the first time we are providing sign language interpretation for this event for our deaf and hearing impaired employees. October is Disability Awareness Month, so it's a great time to be more inclusionary, and we're trying a little bit something new. So bear with us if things get a little rocky at some point. Right now, we are going to be introducing our panel here. Last month, Executive Constantine here transmitted his proposed 2015-2016 biennial budget to the King County Council. That budget reflects some major investments that we're making in our youth, in natural resources and parks, and other levy-supported services. But there are significant reductions compared to previous years in public health, transportation, which we'll be talking about, and criminal justice, and those are going to have impacts throughout King County. So the executive's proposed budget was built to be more efficient, to have a county government that's a lot more efficient than it's been in the past, but it also reflects some of these real challenges that we're facing with the cuts that we're dealing with here across the county, and that is the result of some outmoded revenue structures, which we'll get into. That sounds really complicated, but we've got some folks here who are going to make that very simple. And some of those changes have been imposed at the state level, so we don't have as many opportunities or options for fixing that, but we're going to talk about some that we're putting into place. So today we're joined by our panel of esteemed experts here. Some of them will be very familiar to you. They're senior leaders at King County, and they're going to share more about the details of the proposed budget as it applies to their department and how it fits into the context of the budget overall. As you listen, if you have any questions for our panelists today, you're welcome to send those to us. There's a few different ways. You can do it on link, you can do it on email, or by Twitter. If you want to email it in, the address is employeetownhall@kingcounty.gov. You can use link to send an instant message to Employee Town Hall. Or if you want to tweet your question in, you can use the hashtag KCTH, for King County Town Hall, KCTH. It's hashtag KCTH. So as a reminder, King County does have a social media policy, and we encourage everyone who uses those tools while they're working to become familiar with our best practices. You can visit kingcounty.gov/social media to read the social media handbook about when it's appropriate or not to use social media. And we'll also get to all of those questions that you're sending in the last 20 minutes, and we'll have someone bring those in to us. So before I introduce our panelists today, we're going to show a short video which introduces some of the topics that we'll be talking about today.
By county residents and county employees. Geez, the economy seems to be doing pretty well, so isn't the county's financial situation doing pretty well? People see construction cranes, they see new apartment buildings being built, they see condominiums, they see houses selling rapidly, and they logically would think that the economy is doing very well, and so county government should be doing pretty well. And surprisingly, the answer is we're not. The county's total two-year budget is about $8.5 billion. Of that, about $1.5 billion is what we call our general fund, or the traditional services of county government, such as criminal justice, elections, and property tax assessments. And when you look at the revenue sources for many parts of the county's budget, they really don't benefit from the strong economic growth that we're experiencing. Let's start with the general fund. The general fund is supported by three major revenue sources. First are property taxes, which are paid by everyone in King County. Second are sales taxes. And third are contracts that the county has to provide services to other governments. And those are whatever amount those governments are willing to pay. So the county's general fund is really dependent on property taxes and sales taxes. In Washington State, the law says that a government's property tax revenue, the actual amount we collect, can only increase by 1% per year. And the exception to that is if you have new construction, it gets added to the tax base. So even when the economy is strong, even when people's property values are going up 10 or 15%, county government only gets 1% more revenue, plus new construction, which is maybe another 0.5 to 1.5%. So our total property tax revenue growth is only about 2% per year. Nowhere near enough to keep up with inflation and population growth. And since that's the largest revenue source for the general fund, it means that the general fund has a chronic financial challenge because property tax revenue doesn't grow very fast. The sales tax, the other relatively large tax source for county government, has its own issues. People are typically surprised when they say, well, how much of the sales tax does the county government get for its general fund? And the answer is, out of the 9.5% sales tax that you pay, King County's general fund gets 0.15%, a very tiny fraction of the total sales tax. And that's partly a problem because we have very little tax base in our unincorporated area, the areas outside of cities, where we would get a whole 1%. But unfortunately, less than 4% of all the sales occur in the unincorporated area. So between those two revenue sources, our total revenue might grow, say, 2.5% per year on average, at a time when inflation and population are growing a total of something like 3.5% per year. So the general fund has a chronic financial gap, even when the economy is good.
So that is an excellent introduction to our topics today. Let me introduce our panel. Dow Constantine, King County Executive. Thank you for joining us.
Thanks for having me.
Dwight Dively, Director of the Office of Performance Strategy and Budget, or PSB. Patty Hayes, who's the Interim Director of Public Health Seattle and King County. And Harold Taniguchi, who's the Director of the Department of Transportation. So I'm going to start with you, Executive Constantine, because we had that great introduction from Dwight about why we're struggling the way we are. Can you give us a few thoughts about the budget that you just recently transmitted over to the Council?
Sure. So the budget that I sent to the Council on the 22nd of September was a very difficult budget to put together. As Dwight told us, the economy is doing well, and one would expect government revenues to be doing well. But in fact, we've been facing, even though we've had years of increasing efficiency, of drawing on reserves, of working our way not just out of the recession, but onto sound financial footing, we've also been suffering years and years of federal and state cuts. After the war, really, and actually starting during the Depression, the federal government took on more and more responsibility, and also the states. That pattern of devolution that's been happening over the decades is really coming home to roost, because while the responsibility for providing services is devolving from higher levels of government, the authority to meet that responsibility is largely not. And so that dynamic has proved tremendously difficult in several areas, including public health. There's obviously Metro, and we lost in the late 90s the motor vehicle excise tax, which had provided stable funding for transit. And it's never really been fully replaced. We have a sales tax, which is quite volatile and inadequate. And I think Harold will be able to talk later about the funding challenges facing Metro, as well as the very severe challenges facing our county road system. But here's one statistic that is really startling, and it speaks to the initiatives that have redefined our revenue system in the state of Washington, and perhaps as Americans our unrealistic expectations about what we're going to be able to deliver for the money we've been paying. In this state, over the course of just the last 20 years, the total amount of state and local taxes that you and I have paid has gone down 20% versus our incomes. So per $1,000, you're paying 20% less than you did just 20 years ago for state and local services, and yet we expect the roads to be paved, we expect the children to be educated, and I think that we need to have a serious conversation as a county and as a state about whether those expectations are realistic, or whether we need to construct a revenue system that allows us to pay for the things that we need.
I think that's going to be a surprising statistic for a lot of people, because the scuttlebutt in the street is not that the cost has gone, or that the cost to us has gone down. That's not what we hear very often.
Well, and I think you know why. Those initiatives were advanced with the notion that we would vote at the polls on funding many of the services that used to be included in the general taxes collected and that your elected representatives would prioritize. So if you're asked to continually vote to renew funding for things that used to simply be provided by the government, you're going to think that the taxes are going up. But in point of fact, relative to income, they've been going down steadily for 2 decades.
We've got a chart here that I want you to talk a little bit about. It compares the county's costs versus our revenue. This gets to what Dwight talked about in the video a little bit. Can you walk us through this?
Sure. This is a chart I shared during my budget presentation to the county council, and this is exactly what Dwight talked about in the video. It compares the annual growth of population plus inflation, and this is a sort of 10-year average figure, to our costs of doing government, which, as you can see, are in the middle column, and then the revenues that are available to us. So on the left, population and inflation is about 3.5%. The increase in the cost of doing the same thing we did the year before is about 3.5%. But our own costs are only going up 3.3%. So earlier I talked about the efficiencies we'd been generating. In the old days, the cost of government services went up 5 or 6% every year. But our entire reform program over the course of the last 5 years has been getting a handle on those costs, figuring out how to reduce them while still maintaining the level of service. And that's what you're seeing in that 3.3% figure. You would think that would allow us to balance the budget and even do a little better, but in fact, the problem is revenues go up at 2.5% per year. And that is because of the limitations on the property tax, which are well below inflation, as well as the erosion of the sales tax as a reliable funding mechanism. The cumulative effect of all this, you would think the difference between 3.3% and 2.5 is not that great, but actually you're falling about 1/4 behind every year. And the cumulative effect over the decade will be nearly $400 million in shortfall for county services. So this is a problem we have to face up to, we have to address. It's easy to kick the can down the road, to paper over these problems on an incremental basis. But the fact is that the results of this misalignment, of this gap, accumulate over time. And they significantly erode the services and the infrastructure that undergird the quality of life we expect here in King County.
And that's just something that structural gap, as we call it, that gray area that we see on there, is just based on kind of outdated ways of funding. Like a long time ago, the way we funded things worked just fine.
You know, 100 years ago, 80 years ago, taxable sales made up a much larger part of folks' income. If you had income even 20 years ago, you might spend 50% of your income on things that were taxable. Today it's only 37%. As the world changes and people's spending habits shift towards services, for example, and away from goods, we see the revenue source become less and less robust. And so when we have a recession, people stop spending right away and revenues collapse. But as we recover, they do not rebound in the same way because people continue to migrate their spending from taxable goods to services and other areas where our revenue system simply didn't contemplate receiving revenue 100 years ago.
And they expect the services to stay at that level, even though they brought their spending down.
A reasonable expectation because people don't necessarily spend time studying these intricacies of our state revenue system and the way in which local governments are funded today.
How is the county planning to close that gap there? I know you mentioned some things that we're doing lean, we're making things more efficient in how we deliver services, but what else can we do? Well,
there are short and long-term solutions. And I'm trying to help people distinguish between short-term solutions that are genuine solutions and short-term solutions that are simply borrowing from our kids to keep spending at the current levels. So in the short term, with our public health clinics, we had a big shortfall there, had to propose closing 4 of the clinics, but we have been working with community partners, with our own employees, to find ways to piece together the funding we need to bridge across to that time when we will seek the long-term solution for permanent funding for these clinics. So with the Federal Way Health Clinic, We partnered with the City of Federal Way and our own employees who voted to give up their contractual pay raises in order that we might keep that clinic open. In White Center, it was the City of Seattle and Planned Parenthood who joined us as partners, and we're working hard with the City of Auburn and businesses in Auburn and other partners to try to find a way to keep the Auburn clinic open, which also serves the Muckleshoot Reservation and a satellite in the city of Enumclaw. But over the long term, we really have to develop solutions that get us out of this antiquated and really inadequate revenue system. A key point in the general fund budget is 3/4 of our money goes to the justice system. And that is a figure that would have been even higher had we not started making significant adjustments and reforms a decade ago. 3/4 of that money that goes to paying for essentially bad outcomes, unsuccessful lives, people who've gotten off track. So we need to find a way to identify revenues, even as we're maintaining our responsibility in the justice system, identify revenues to start getting to prevention, to investing earlier in people's lives. And I don't just mean when they're having trouble in high school, although that's important. I mean getting all the way back to those first few years of a child's life, when the brain development we know now scientifically, the critical brain development is happening that's going to equip them to be able to be successful in school and be able to be successful in life and to be productive contributing members of our society rather than becoming an expensive challenge for you as taxpayers and for our justice system. And that's why I've proposed an initiative that I call Best Starts for Kids. And it's really based on scientific work that's being done at the University of Washington around child brain development. And the recognition that the lack of enrichment and engagement that some children are getting of adverse childhood experiences is severely impacting those kids on a permanent basis. That the brains develop their brains are not developing in the way that they need to develop in order for them to really completely fulfill their potential. And we can't simply stop, trying criminals or enforcing the law in order to take some of that money and move it back upstream, even though if you're a business, that's exactly what you do because it's a much better investment. We need to create the capacity, just an ounce of prevention, so that we can, in the next generation, realize that pound of cure. I am really looking forward to working with everyone who's interested not just in child welfare, but in the entire structure of our government and our justice system, so that we can get to these kind of rational solutions that we know will work.
And you mentioned starting earlier. You're talking, I think you've used the term, is it the first 1,900 days, 1,000 days, something like that?
It's the first 1,000 days, and we really want to work with pregnant moms who may be at risk to make sure they're getting proper nutrition, to make sure that they're not smoking, drinking, using drugs. And then when the kids are born, the first 1,000 days are so critical, and ensuring that the mom, the family, and in fact the community is providing the support that young child needs to develop. That will not only redeem that one life, make sure that kid gets off to a good start, but that's a smart financial proposition for you as taxpayers. And I think that ultimately we are going to see many others following suit in figuring out how to invest in prevention rather than simply continually paying for bad outcomes.
I wanted to touch on something you just said a few minutes ago too, just to reiterate. You said the employees had voluntarily given up some things so that we could keep services going for the community. So I think a thank you to them. I want to extend that.
I have to say, when we were in the recession, most of our employees stepped up and said they would forgo their cost of living adjustments in order to keep services flowing and in order to keep their colleagues employed. In this crisis in public health, our nurses, represented by the Washington State Nurses Association, have stepped up. Our other professionals in public health, represented by the professional and technical employees, Local 17, voted as well, saying, I know we're entitled to pay raises, but we are going to give those up so that we can keep these clinics open. And I think it speaks very well to the character of our county employees and to the reasons that they came to public work, that they, of course, want to provide for their families, but they also want to make a difference in their communities. And they're very much doing so through this work.
Thanks. Thank you, too. Dwight, I'm going to turn to you now because appreciate you doing the video. I always say you give the best, simplest explanations of really complex budgetary topics, so I appreciate that. You've spent about 30 years working both at the City of Seattle and at King County, working on budget issues, and I've heard you say this is the most difficult budget you've ever had to do. Explain that a little bit more, because some people will say, ugh, those budget people. Every year's the worst year. Every year is bad. Why is this one different?
I think if you look at what we've had to do year after year after year, biennium after biennium, where the revenues aren't growing as fast as the expenditures because of these revenue limitations, and you constantly have to kind of have a little sawtooth where you cut back down to a lower level, that's always a big challenge. And on top of that, we've layered on the fact that the state and the federal governments are now kind of abandoning their commitments that support many of our programs, and that's really the main issue in public health, is the state's basic funding for public health. The dollar amount has not changed in over 10 years. Wow. And so it doesn't keep up with the increasing costs of wages and benefits and medicines and all those kind of things.
Plus the increased demand.
Absolutely, plus the increased demand. And then similarly, you have the problem with federal support where they literally cut it in half. And that means that we don't have the flexible funding that we used to have in order to be able to operate things like public health clinics in the way that we used to. So why this budget is so challenging is because you have these things coming together and affecting so many of our funds. It's not just the general fund. It's not just transit. It's roads, it's public health, it's mental health, it's workforce training programs. All of those are being affected by this. Many other bad budgets, you can say, well, yeah, it's all in the general fund or it's all in roads, and it's concentrated where you've had those problems. This year, for this biennium, it's just about everywhere.
Wow. There's a chart up here that kind of illustrates some of what you were talking about. Can you walk us through that just a bit?
Yeah, so one of the things that this administration has been about has been trying to drive down that historic cost growth that the executive talked about, where costs were growing 5 or 6% per year. And we've worked with our unions, we've worked with our employees, and we've very successfully managed to reduce that. A single largest thing has been getting employee health care costs down through healthy incentives and other actions. We've also applied the lean continuous improvement methodology. And the success of that is shown in this chart, where instead of 5 or 6% annual growth in costs, we've gotten that down to about 3.3%.
So that's the gap between the red dotted line and then the black solid line.
Black solid line, exactly. And so that part of the message is great. But then when you look at the fact our revenues are only growing 2.5% per year, you still can't even keep up.
So unfortunately, Patty, your department has been mentioned several times, as we've talked about, where things are really challenging right now. So can you talk a little bit about how that's playing out? How are these budget impacts showing up kind of in our work?
Well, as has been stated, this has been the perfect storm coming together for public health. This is not a new challenge and has been coming for many years in its manifestation. The motor vehicle excise tax, it was pretty much hidden to the public that a portion of that was for core public health services. And so the repeal of that 14 years ago really started a challenge for public health on what's going to be a stable funding source at the statewide level for all the public health system. That still hasn't been resolved. The state legislature has been trying to address it by little bits of money here and there, cobbling things together, and we've been on work groups for many of my professional years trying to really pull that together as to how the public should expect a level of service from public health so that we are able to respond and contain outbreaks, so that we're helping communities, so that we are ready with the latest data to show what our communities need. And indeed, as the executive said, we are the brain trust for where to go forward with moms and kids with brain development. That's public health work. So with the challenge of MVET, and then over the last about 2.5 years, the federal government has severely cut a program called Medicaid Administrative Match, or Medicaid Administrative Claiming. It's a technical term for a program that was used to help connect people to resources, get them enrolled in care, and then making it successful so that they could maintain a level of health.
So that is for pretty much our most vulnerable population, right? Folks who they don't have an employer that provides health care, they don't have any other options, really.
That's right. Okay. It targets the most vulnerable folks. And even with healthcare reform, we were hoping that that was going to turn quite a bit around. But what we found with all of this coming together so quickly, the 50% cut in this major federal program and our long-standing issue, we reached this year where even with some of the benefits of the Affordable Care Act, there was great expectation that the Affordable Care Act was going to cover a lot of public health services, and it just doesn't. So that's been a challenge for us to message and be clear to the public, especially with these very vulnerable and low-income and disadvantaged populations. There isn't a revenue stream for public health to be using for that with all of the stress. So it's come back to the first budget was closing clinics and then us working aggressively for what is a short-term solution while we look towards things like Best Starts for Kids and continuing to work with the state. I think if King County goes into this level of distress in public health right in the middle of when we're dealing with concerns around Ebola and the water system problem at Mercer Island and the flu season coming up. I mean, it's going to become very apparent if we don't have stable funding for public health.
So I don't want to be all doom and gloom because it is a difficult situation, but I know that you're also really looking down the line of, we have no control over the current situation, but we can start taking some steps to prepare for it, to start aligning our processes and our services to deal with the revenue that we do have. What are you guys planning for the future?
Well, there's great work that's been going on over the past 2.5 years since I've come into the county. The clinics are doing awesome work through lean processes to look at how their productivity is going, how are they reaching out to communities, how are we using our staff to their highest potential. So that's all great work that's going on right now. I've been working with the state on a couple of our programs to make sure that we can maximize in new models in for example, a maternity support services program. We're looking at the state agreeing to fund a new model, which is going to be group delivery of services. And for a lot of our communities, they're very excited about that. And that also brings an efficiency potential into the program. In addition, we've looked at our administrative efficiencies that we can put into place. And again, using either lean opportunities or partnering or looking across the agency, we've moved forward with that. I've taken cuts in the Office of the Director, and with that, made sure that we wouldn't have too big of a cut in our communicable disease unit. Because again, I'm so grateful I did that, because right now we are stretched to the max with all the concern that's going on. So we're working across the whole agency and trying to get as creative as possible. And the partner engagement that we've entered into over these past number of months, one of the side benefits to that is I think that a number of these partners are actually going to join us for the conversation at the state level, because this does go back to a statewide conversation. And it's a terrible year in the legislative session, but it needs to be brought to that and a more permanent solution. So I look at this as developing multiple new funding streams for public health as possible.
And that's an excellent point that you made, that it's not just King County. Like, the challenges that we're having here are being echoed in every county around the state. I think it's more noticeable because we're the biggest, but the same challenges in funding and cuts at the federal and the state level are also happening in other counties around the state. So it really does need to be a statewide conversation about how we fix our funding system.
Right, that's absolutely true. And a lot of the counties have gone through cuts already, and many of them have shut down some of the very valuable programs that this community is saying, no, we need to be more thoughtful about this, we need to look at a different way and support the core public health assets. So I'm very grateful for that.
Okay, thanks, Patty. Harold, I'm going to turn to you because unfortunately you're part of this club that no one wants to be part of, where you're taking the deep cuts, you're having the biggest challenges. So DOT has the biggest headcount for the county. You guys have decreased quite a bit, but you still have the largest number of employees for any of our departments. So I want to ask you a little bit about how that's affecting, I know transit, we have heard a lot about how it's impacting there, but also road services division, and all of these cuts are happening at the same time that Dwight has mentioned. We're still growing quite rapidly, actually, for a county. So how is all of that playing out for your department and your staff and the services that you're trying to provide?
I have no idea. No, I'm kidding. Great segue to this wonderful challenge that we have this year, and it's been leading up to this for a bit. So let me give you some numbers here to deal with. You know, in the transit side, because of the sales tax, there's been, off of our projections from just not too long ago, you know, we're about $1 billion plus off of where we thought we would be. In the last several years, Kevin Desmond and company have done a terrific job putting forward a whole series of efficiencies and reductions to keep that service out there the way it's been for a while, about $800 million worth. But that cannot be sustained. So looking forward, we have to, because Dwight, wonderful introduction about the sales tax, that's coming back, but not coming back significantly enough, that we're looking at some additional service cuts. We just implemented some this last month, and we're looking forward to, in the budget proposal that the executive transmitted, cuts in the first part of next year, and we'll see, because that's under discussion right now. Mm-hmm. And the financial policies surrounding that have to do with risk, and we welcome that discussion, but we'll see how that ultimately plays out. So on the transit side, there have been some service reductions that we're experiencing. We've had numerous fare increases over the last few years. And still, our budget still has some additional efficiencies that are accommodated in it, some additional reductions, and we're trying to be smart in terms of how we put forward our service. And we'll continue to do that. Fortunately, on the transit side, a few years ago, we had a strategic plan developed coming out of a task force. And that really set the stage for how we balance the needs that we have to put out a productive service that's efficient, to deal with the equity and social justice issues that are out there for populations that are dependent on our service, low-income and minority populations, as well as deal with where we are throughout the county in terms of geographic value. And those guide the decisions that we make as we put service forward and as we reduce service, trying to do it in a very transparent way. The executive also mentioned on the road, and Dwight did as well, the road side of the equation. Property tax is about 78% of the road, where the road's revenue comes from, and that took a significant dip in the last few years. In fact, I think it's dropped. It's coming back certainly a little bit now, but about 40% of it has dropped over the last year. So those of us who are property owners that pay property tax, but if you live in unincorporated King County, you were paying maybe on average $70 to $90 less per year in your property tax, just maybe last year. That deeply affects us. That dropped the floor of our revenue in our financial plan, and coming back is a very, very slow process. So roads is a fraction almost of what it was. We've dropped the employees by over 40%. It also has a strategic plan that's guiding in a thoughtful way. Well, what do we do when we're nowhere near maintaining our own and, in fact, dealing what we really have? We have a strategic plan in roads that called for, you know, if you want to do this right, you maybe need about $350 million a year, and we're funded at about $100 million.
Wow.
So not only are we trying to be thoughtful about the decline, we're trying to be really thoughtful about decline, knowing that we have money that's nowhere near what it takes to really do it the right way. So again, we have some guidelines that, in a thoughtful way, provide us some direction on how we do this. We're focusing on operational safety and regulatory requirements that we have. But clearly, you will see the roads continue to degrade. A scary statistic, over the next 35 years, we think about 25 bridges and about 70 miles of roads will either be, you know, posted for lower speeds, lower low limits, or in fact just closed. So we're not looking ahead at a bright future in terms of, if we keep on this pattern with the finances that we have, what's in for the roads division.
It's a challenge. I wish we had that. We have a great map that I've seen that shows the unincorporated area of King County and how it's decreased significantly over the past like 30 years through annexation. So, I mean, annexations are a good thing. We like that when annexations happen. But what the impact is that there are fewer residents in those areas supporting that tax base that's just for like the roads and unincorporated areas.
And the other thing that happens with some annexations, like Klahanie, for example, I mean, we get revenue from Klahanie and we pay money into taking care of that similar area, but the road miles that go away are a small fraction. In fact, you know, it's a small fraction, so it doesn't proportionately mean we have to do less. We just lose a chunk of the revenue.
Mm-hmm. Thanks, Harold. That's it's fascinating to hear how all of this ties together, because it really does. It's a system, right? That's a government system, and all of this is tied together: the revenues, the impacts, and the employees who are still continuing to provide all of the great services that we have. Executive Constantine, I'm going to turn back to you here and ask, we've got employees here with us in the room. Thank you all for joining us. And we've got folks watching and listening. What can they do? You know, each individual, we've got so many different lines of business. What can they do to help with this situation that can seem pretty daunting sometimes?
Well, it is daunting, and before I get into that, I just want to go back to something you said before, you asked before, which is about the tax system being antiquated, being from another time and reflecting a different reality. And one of the things Harold was just talking about, the loss of unincorporated tax capacity goes directly to that. The tax system for paying for county roads is from the era before the Growth Management Act. And so after the Growth Management Act, we said those places with businesses, with urban levels of development, with high property valuation essentially, need to be inside cities. But as he mentioned, most of the roads still remain with the county, including the debt for some of the structures we have built in areas that subsequently became part of cities. And that is a huge part of this dynamic that simply needs to be corrected by the legislature. You have these regional facilities that everyone uses.
So like bridges and
bridges,
certain highways.
many bridges, highways, and just arterials that are in between cities,
Right.
many of which are areas that used to be unincorporated and paying for those roads. And you're just leaving the remaining unincorporated residents to continue to fund that infrastructure. And it's something, that's the kind of major structural challenge the legislature is not great at dealing with on a year-to-year basis, but has to at some point engage. Now, our employees have done amazing work in helping us deal with all these realities. During the recession, employees stepped up, as I said before, and gave up their cost of living adjustments in order to keep services flowing. In public health and in transit, our employees, specifically in those departments, recognizing the challenges, have provided wage concessions that have kept their services going and kept their colleagues employed. But also there have been collective efforts by management and our employees, and I think one of the best examples is healthy incentives. You know, in many private and public contexts, the conversation is about who is going to pay the bill. Is management going to pay, or are they going to try to shift the cost to employees? But the primary dynamic in healthy incentives is for us to join together and address the real challenge, which is the runaway cost of healthcare in the United States, the cost of the system. And when we unite around that and we start focusing on the ways we can drive down cost, we're able to save the employee money, able to save the public money, and able to keep services flowing. And that is the philosophy that we want to center our work on. So in Lean, we don't simply say, employees, what can you concede in order for us to be able to balance the budget? We say, employees, own this challenge. Bring your creativity and your experience to the table to help us figure out how to identify and eliminate the time and money that is being unnecessarily expended, that's being wasted. And when you do that, you're able to provide more of the service the public is hiring us all to provide. And you know, that efficiency is really important. It's also a way for us to think about the way we provide services and to transform those services. One example is the Health and Human Services transformation. And that is a place where we're bringing together these two very related areas of governance and refocusing on how we deliver services based on the outcomes we're seeking, based on a focus on the client, on the person who's receiving the services, and getting away from the traditional one-size-fits-all approach, getting away from the siloed approach where we send an individual resident of King County to a dozen different places to try to solve what's a related set of challenges. It's more efficient, it's more humane, and ultimately it's going to allow us to deliver more service for the dollars available. We're a better run government today than we were a few years ago for a lot of the reasons I stated. We've set a very high goal of being the best run government. The best run government we can be, the best run government in the country. We have the kind of people here inside and outside of government who can help make that happen. And I am so proud of the progress we've made, but more excited about that which we'll make in the next few years.
Yeah. And I'll just add, as Director of Customer Service, I often get to hear directly from the public when things are going well, but also sometimes when they're not. But I will just share, we did a customer service training, actually, Patty, with some of your staff, and the public health folks there talked about, they were giving kudos out, and they were giving kudos to some of your staff who'd actually gone into their own pocket to round up clothing and some blankets. They had folks who had come to a clinic in the middle of last winter, and they were immigrating here from a much warmer climate and basically had the clothes on their back. The mom was pregnant, and that's why she was coming to the clinic for some assistance, and they didn't really have anything, and so the clinic employees actually took up a collection and bought new blankets and things for the family so they would be comfortable as they were getting settled here in King County. So those are the types of stories we don't hear about a lot, but that's happening a lot behind the scenes, where folks, if they can't make a change at the structural level or change the processes or can't think of something right away for lean, they're doing something day to day to help make sure our customers rather and the public is getting what they need from King County. So they deserve kudos as well. They're amazing folks. Thank you, Executive Constantine. So we're going to take some employee questions now. I said off the top that there are a few different ways to do that. You can email it to employeetownhall@kingcounty.gov. You can use link to send it in to Employee Town Hall, or you can tweet your questions with the hashtag KCTH for King County Town Hall, and we'll pull those off and get those here to our panel. So does anybody here in the auditorium, before we get started, have a question for our panel at all? No? Oh, one there, okay. Go ahead. And go ahead and introduce yourself, and then we'll repeat your question.
Hello, my name is Angie, and I'm a community health worker with public health. And my question is about funding, and Interim Director Hayes talked about this lack of funding with the loss of funding through the motor vehicle excise tax. And then the point I want to bring up is about prevention in public health, and Executive Constantine, you mentioned about that, so I appreciate those comments. I feel that public health in King County is about all our communities in all of the cities, places where we live in King County, and that it's to public health is also to help build, maintain, and keep healthy, safe communities for all of the residents, and that is of any age, any race, any gender, et cetera, including financial status too. And Executive Constantine was talking about the closures, proposed closures, and that Auburn Public Health is slated to be closed if not saved. That I wanted to talk about the services that they have there, and that is the WIC program, which is Women, Infants, and Children, and the MSS program that a lot don't know what that is. So that's the maternity support program, as well as family planning. And I believe that those services that are offered there are all very much about prevention. And my ask is that we find stable funding. This has been, like Hayes mentioned, it's been 14 years since that loss of funding, and public health needs a funding source, and it's time to do something, and I appreciate the efforts that are being taken for that, but public health needs a funding source that is stable and long-term so that we continue to provide these services that are very much important for everybody in the community here.
Thank you. Yes, please.
Well, first of all, thank you. Is this working? Thank you for that. And why don't you give me that mic? I'm on now. That's good. Thank you for that. I agree with you wholeheartely. You know, the WIC and MSS, the Family Planning Services, are the sorts of services you might not get through health insurance, even the health insurance that people are now getting finally under the Affordable Care Act. They're the kinds of services, though, that help prevent problems in the future. That is the ounce of prevention. And MSS, maternity services, is exactly the kind of service I was talking about when we say we're trying to get to the at-risk mom to make sure that she's getting the nutrition and the support she needs, and then that child is getting the support through the first few years of life to get off to a better start, to start on a better trajectory, to arrive at kindergarten with your peers ready to learn rather than getting farther behind, eventually dropping out and having a lot of challenges throughout life. The Best Starts for Kids levy that I've proposed would in fact address some of those kinds of programs inside and outside of government. And I think that we need to focus on that as one way in which we preserve the kinds of services you just described, but we also need to focus the state legislature's attention on the central role of the, invisible to most people, public health services in this state to protect our quality of life, whether it's protecting us against contagious diseases, for example, or making sure that food is pure and safe, or whether it's providing frontline services and frontline prevention services in public health clinics. Public health is every bit as important a piece of infrastructure as roads or law enforcement or any of the other things that are more visible to the taxpayer. The state legislature has to take that seriously. They have to provide us, if they're not going to provide the funding as they used to through the motor vehicle tax, they at least need to provide us the authority so that this region that has high expectations can protect our quality of life.
Thank you. I'm going to take a question that we received over email. This one's for you, Patty. It's about public health costs, specifically the overhead costs. So this is the cost of keeping the lights on, having a building, having the equipment in each of the buildings. So this person asked, what steps is King County making to reduce the overhead costs that we have to pay to provide the direct services, such as public health services for low-income folks? Who evaluates and makes recommendations about the overhead costs? And the operational costs for lean efficiencies and right-sizing the organization in King County.
So I'm going to team tag this with Dwight because overhead, of course, comes at different layers. I mean, there's an overhead cost to the clinic system itself, and we've been working to analyze how many do we need for supervision in that? What's the right spot for that? We've been looking at our billing procedures and doing work to make sure that through the great work of productivity that the staff is doing, that we're able to get payment for those services when payment is available. So we've been doing a project with on that to make sure that we've got the right staff to help to do that. Then, as I mentioned in my office, we've been looking at what are those core services that we need to have both in our overhead and directly out of the office of the director, so that we continue to be able to move public health in the way that the public expects us to be able to do, but also have enough capacity for response. We are looking at everything from our contracting procedures to our IT work and developing options and ways of looking at that to make sure we're as efficient as possible. But I also think that it's about the whole agency working together on this in the future and really looking towards how we have some of the most demand in areas such as working with communications. Communications is such an essential core infrastructure for the agency that's not not visible unless we have an outbreak, or we need to make sure that we're working with populations. For example, when there was the storm a number of years ago, and one of our populations actually was bringing in heaters that actually made a toxic environment. We had some deaths. That was our core staff that made sure that we got out and worked very dynamically with that community for safety. So all those things are, it's something that we're working really hard towards right now.
Let me talk a little bit about what some of the other county agencies that support our direct service agencies, like public health, have done. So in this budget, agencies like the Finance and Business Operations Division, that's accountants for everyone else, the Facilities Management Division, Casey Information Technology, many other of those internal service agencies found a whole lot of efficiencies, which allowed us to save public health clinics. It allowed us to save transit service. It allowed us to continue a bunch of our criminal justice programs that otherwise we would have had to reduce. When you actually look at the amount of efficiencies that have been generated sort of agency by agency, some of the very best by far were our internal service agencies this year. And literally dozens, if not hundreds, of jobs and services were saved because they found ways to be more efficient.
That's excellent. And those are the folks who make it possible for everyone else to do their work, for folks who may be watching. So facilities make sure we have clean buildings and equipment is up to date, and carpenters and painters and all those electrical. And IT, of course, provides the technology that we all depend on to get our work done as well. Okay, that's excellent. Thanks, Dwight. Thank you, Patty. We have one question that came in over link. This is from Alan in Public Health. Why not develop a regional transit authority that encompasses all modes of transportation? So Sound Transit, Metro, Community Transit. Wouldn't that reduce redundancy costs? So as chair of the Sound Transit Board, this would be a good one for you.
Well, thanks for the question. And we are actually doing a lot of work to get the benefits that you allude to. For example, I've launched a Sound Transit King County Metro integration project, like Public Health and Human Services, where we are working to bring together all of the planning and operations of those two agencies where it makes sense to do so, where it can be productive to do so. And we've just started a few months ago and already have results and a lot of great ideas, both short and long term, that will yield more service for the total transit dollar available. Now, the question often comes up, why don't you merge just the transit agencies across the region? And, you know, in time, this region may evolve so that we have a fairly uniform appetite for a high level of transit and willingness to pay for it across the 3 or 4 county area. Right now, those preferences vary a lot. And so there is also a value to having local elected officials whom you know and who are responsive to the local desires of their constituents for transit. The representative from Lakewood in Pierce County or from Marysville may view in bus investments quite a lot differently than the representative from Capitol Hill in Seattle. Right. And so if we're able to get the efficiencies on the operating and planning side, but maintain the democratic value of accountable local leadership, I think we've kind of found the best of both worlds. When you mix in roads, it creates an interesting dynamic because the duties are very different. Operating transit system, although the buses operate on roads, is quite a lot different skill set from making sure that those roads are paved. And I don't know if Harold wanted to chime in on that aspect at all, but although you're in charge of both of them, they don't have a lot to do with each other.
Well, there is a great deal of coordination. I guess one other way of asking that question is having on the city side, working with the county, you know, everybody has their own public works entity, and what's up with that. So the efficiencies certainly are, if there is a large paving project, you know, let's make sure that we're smart about that, and at times we work closely with cities to help with the paving. But mainly the planning thing is key. And in the years ago, we were terrible at planning, I thought. Cities would do their thing, the county would do its thing, and then you'd have a 4-lane road go into a 2-lane road, go into a 5-lane road. Much, much better. I think the granting authorities got smart and says, you aren't getting any money from us until a corridor is being very thoughtful. So I think that has gone a long way to making the jurisdictions that are roads, public works oriented to cooperate much more effectively. So, but we'll just keep working it and keep coordinating. And snow and ice removal, taking care of the transit routes is a key example of how well we are coordinating, much better than before.
And so there's 39 cities within King County, and when we have those snow and ice events, I've been down at the Emergency Operations Center, and all the cities are really good about kind of lending mutual aid. We need a plow, who's got one that we can get over to this location, that sort of thing.
Yes.
Oh, okay, thank you, Harold. So, yes, back here. Okay, we've got one there. We'll do one here, and then we'll wrap up.
And I work for public health. I'd like to, I appreciate this opportunity to address you today. I am working in the Auburn area, clinic slated to be closed. My great concern is that the county is, over the last several years, and I have worked for the county for 19 years, had a tremendous push for equity and social justice. And I wonder, with the cuts that are being made now to the south end, which is, as we all know, our neediest area with the least amount of resources, and we have no community partners in the south for Enumclaw, Muckleshoot, Auburn. Auburn Clinic is also the most productive clinic in King County. Why it would be slated to be closed when equity and social justice, I can't find it in that. I am an interpreter. I work helping women, and the vast majority of them are undocumented. As we all know, the Affordable Health Care Act leaves those people out. I know this is a political issue, but the health of babies and pregnant women is not a political issue. And it appears to me from this budget that equity and social justice is not being addressed. Mr. Executive, you stated that the cost of living in King County is approximately 3.5%.
No.
The COLA, the cost of living increase.
The inflation plus population growth is 3.5%, and the cost of county government services has gone up about 3.3%.
Okay, excuse me. I misunderstood. But I am concerned that the employees have taken not only a freeze for 2 years, again, in cost of living, but step increases also. And we've done that so that these people can be served. And yet, that isn't really happening, at least for the poorest areas of King County. And there also, I would like at the same time to address, I have the budget here in my hand, and I'm not, economics is not my strong point, but I do see a 407% increase, or 18.9 million, in cultural development.
So there's a couple questions there. One about equity and social justice as it applies to the Auburn Clinic in particular, and how that was weighed, and then the other increase for cultural programs. So Dwight, do you want to take that?
Yes, let me do the second one first because it's the easy one. So one of the challenges of doing a budget for the county is that under state law, many of our revenues are restricted to particular purposes. So the money you're referring to for culture or the Cultural Development Authority is money that comes from hotel motel taxes that by state law has to go to those kind of things. So we have no ability to move that money to save public health clinics, unfortunately. To your question about equity and social justice, these are extraordinarily difficult things to have to try to do. And you are absolutely right. There are very severe adverse equity and social justice consequences to many of the things we had to do in this budget. And it was a question of having to choose among lots of bad options when we had to put this budget together. So no one is going to sit here and say that these are good things to cut, that there aren't adverse consequences. There are. But if you looked at the alternatives that you had and the constraints that we operated under, we thought we put together sort of the least bad budget we could. And that's really what drives us to say we have to have new ways to get revenue in order to serve the people who need to be served.
And this work that we're doing with partners, with our employees, with Planned Parenthood, with Seattle and Federal Way, and with partners in Auburn with whom I'm working today, in fact, to try to find a path to keep your clinic open. These are interim measures to bridge us across to that time when we can have a stable and adequate funding source for public health. We have the Best Starts for Kids levy proposal, which we'll be working through over the course of next year, but we also have on our legislative agenda a clear request to the state legislature to fix this problem, to make up for the loss of the motor vehicle excise tax, to make sure that this core function of government, of local government, is able to function. And I am very concerned about the equity impacts of any of the cuts we're having to make, which is why we've gone to such lengths to preserve the White Center Clinic, why we've gone to such lengths to preserve Federal Way, and why we're working every day to scrape together the funds that we need in order to keep Auburn open. And North Shore was the fourth clinic that was slated for closure.
I've got one final question because we're just about out of time here, but I think you may be able to answer this one in 30 seconds or so. This comes from Beth in KCIT, who asked about the funding problems that you're just alluding to. It appears a large part of our funding problems at the state and local level are a consequence of binding citizen referendums. Does the current conversation with the state legislature include an examination of the problems of the referendum process?
Yes. In my budget address, I called on the state legislature to revisit the initiative I-747 that limited property taxes to a 1% increase, and to recognize that in order for us to simply provide the same level of service from year to year, we have to have a change in that limit. And there are legislators who are hearing that and taking it seriously, and that's going to be, I think, a pretty significant conversation this year. On the question of specific funding for transit and for public health, we continue to request that the legislature rationalize the system, and for local roads, that they rationalize this system, bring it into the 21st century, and recognize that the people of this state, and particularly this region, have high expectations that we should be able to meet.
And as private citizens, we feel free to contact our legislators and let them know about this.
Absolutely.
All right. Thank you, everyone here in the auditorium, and the folks who tweeted and linked and sent us questions in. Thank you for corralling all of those questions, and thank you, panelists, for sharing all of your knowledge and insights today. I really appreciate that.
Thank you.
Before we leave, remember that the annual giving drive is underway right now through November 21st, so you can support a number of the nonprofits who are available through that program and participating in this year's drive. We have a short 2-minute video about the employee giving campaign. Thank you for joining us, and have a wonderful rest of your day.
Thanks.
The $5 pledge for Seattle Humane Society would mean a number of things. It could mean education. It could mean low-income spay and neuter services. It can also mean pet food bank food for more low-income people throughout King County. It could mean more pet training, and it could mean that you could meet your next new best friend.
$5 every pay period would help answer approximately 1 call to our 24-hour crisis line each month. People who call the 24-hour crisis line are usually in emotional distress, or we have many people who call. We take actually over 5,000 calls a year from people who are considering suicide. And of the people who call us, about 78% actually agree to keep themselves safe and get further help after they've talked to us. So it really, your $5 donation per pay period could save someone's life.
I think one of the most important thing about being able to pledge through your charitable fund drive is that ability to give through your paycheck. That right now I couldn't write a check for $200. I would look at my balance and say that's not going to happen. But when you can give just $5 a week or $10 a week or something that's comfortable for you, you can give more over the course of the year. You are helping those people budget. You're giving them money that they know they're going to have over the course of the year. They can leverage your money against other opportunities, and they all work together. we're all working together to make this a better place.